Today we will talk about what blood pressure is considered optimal for elderly people and why there are so many myths on this topic. If you are over 60, 70 or even 80 years old, this information can truly improve your health and quality of life. Let's start with the fact that arterial blood pressure is the force with which blood presses against the walls of your blood vessels. It is usually measured using two indicators, systolic and diastolic pressure. Systolic is the upper number and shows the pressure when the heart contracts and pumps blood out. Diastolic is the lower number and shows the pressure when the heart rests between beats. For young and middle-aged people, the ideal blood pressure is generally considered to be around 120/80. But what about elderly individuals? Many people think that older adults should have slightly higher than normal blood pressure, and this often leads to mistakes in treatment. Modern research shows an interesting fact. For people over 65 years old, the ideal blood pressure is considered to be no higher than 130/139/70/79. Why is that? Because too low blood pressure can be just as dangerous as too high. Let's take a closer look. As blood vessels become less elastic with age, blood pressure naturally rises slightly. If you suddenly lower it to a young level like 110/70, the brain, heart, and kidneys may not receive enough oxygen. This increases the risk of fainting, falls, and even stroke. On the other hand, excessively high blood pressure, for example above 160/90, accelerates damage to blood vessels and increases the risk of heart attack, stroke, heart failure, and kidney problems. It is important to understand that the ideal blood pressure for an elderly person is a balance. It should be high enough to ensure that blood can deliver oxygen freely to the organs and low enough to prevent damage to the blood vessels. Many cardiologists recommend monitoring blood pressure regularly. In elderly people, it can change several times a day. Keeping a blood pressure diary, noting morning and evening readings. This makes it easier to detect dangerous fluctuations. Discussing not only the numbers, but also how you feel with your doctor. Sometimes the pressure may seem normal, but the person experiences weakness, dizziness, or fatigue. Now about medications. In elderly people, antihypertensive therapy should be handled with particular care. Too aggressive a reduction in blood pressure can cause fainting and falls, which are extremely dangerous at an older age. Therefore, doctors often choose a gradual reduction in blood pressure and combine medications with non-drug approaches. What are these methods? Here are several proven ones. First, physical activity. Even light walks of 20-30 minutes every day help maintain normal blood pressure and strengthen the heart. Second, a balanced diet. Limiting salt and consuming more vegetables, fruits, protein, and healthy fats helps keep blood vessels in good condition. Weight control. Excess weight increases the workload on the heart and raises blood pressure. Quitting smoking and alcohol. Even moderate alcohol consumption raises blood pressure in many older adults. Stress reduction. Meditation, breathing exercises, and communication with loved ones all help keep blood pressure within a normal range. Many people wonder, what about coffee and tea? Scientists currently believe that moderate coffee consumption is generally safe for older adults. However, if you notice that your blood pressure spikes after coffee, it is better to limit the amount. Another important point, older adults often have chronic conditions such as diabetes, heart disease, or kidney disease. In such cases, the ideal blood pressure may differ from general recommendations. For example, in people with diabetes, doctors often aim to keep blood pressure closer to 130/80 to reduce strain on the blood vessels of the eyes and kidneys. So let's summarize. The optimal blood pressure for older adults is usually around 130/139 systolic and 70/79 diastolic. Too low blood pressure is just as dangerous as too high. Regular monitoring of blood pressure and keeping a log is important. Medications are prescribed with caution, and non-drug methods are often effective. Lifestyle is a key factor: movement, nutrition, weight control, and stress management. Remember that numbers are only a guideline. The most important thing is how you feel. If you experience weakness, dizziness, swelling, or shortness of breath, this is a reason to see a doctor immediately. And a small piece of advice from cardiologists: never try to adjust medication dosages on your own without consulting a doctor. This is especially important if you are 65 or older. One more secret that is rarely mentioned. Controlling blood pressure is just as important as controlling blood sugar and cholesterol. Sometimes older people feel normal, while their blood pressure is gradually rising. This is a silent killer that increases the risk of stroke and heart attack. Therefore, it is better to take preventive measures in advance. Monitor your diet, regularly measure your blood pressure, discuss any changes with your doctor, and adjust your lifestyle accordingly. In conclusion, proper blood pressure is not just about numbers, but about quality of life. When it is within a healthy range, older adults have more energy, less fatigue, a stronger heart, better sleep, and improved memory. If you found this information helpful and want more health tips after 60, be sure to subscribe to the channel and like the video. Here we will discuss how to stay active, improve well-being, and live a full life regardless of age. Thank you for being with me. Take care of yourself and monitor your blood pressure. Your health is in your hands.